Hi, and welcome to Fairview Range Focus. My name is David Hall. I'm the Vice President with Fairview Range, and it's a pleasure to welcome you here today. During this monthly segment, we talk about health care related topics that are hopefully of interest to our communities, and we appreciate you tuning in today. Today I'm visiting with Dr. Laura Stoiber, who is a general surgeon at Fairview Range, and we're going to talk a little bit about minimally invasive varicose vein treatment. I practiced that very well. It's called Venefit?
Venefit
Procedure. So thank you. I appreciate you joining us today. So let's maybe start, and for a lot of us, including myself, probably not as educated about varicose veins and this procedure and everything, tell us just maybe in general, what is this procedure and what does it involve?
Well, what the Venefit procedure is, it's minimally invasive treatment for varicose veins. Varicose veins are extremely common in the U.S. There's 30 million people that have varicose veins.
Wow.
Yeah,
okay.
Quite a few people walking around out there.
Okay.
So the Venefit procedure is one of the latest procedures that we have to treat varicose veins, and the recovery time and downtime are significantly less than traditional surgery that we have for varicose veins. So less pain, less recovery time, and gets people back to work and back to their regular activities much quicker.
Okay. So what causes varicose veins? It sounds like you said pretty common.
Mm-hmm.
What exactly causes it? Is that known?
There is a series of valves in the veins.
Okay.
And what happens when you get varicose veins is those valves become damaged or destroyed. And it's very, very common with pregnancy, with weight gain, with people that have occupations that require them to stand. And as we age, it can occur as well.
Okay.
And so because the valves are damaged, the blood pools in the leg, and you see the veins become very prominent and bulge underneath the skin.
Okay.
And they can also become very painful, and they can progress and lead to a lot of swelling and redness in the legs. It can also cause restless leg syndrome, so people that have trouble sleeping at night. And if it progresses too far, you can get changes in the skin, and you can get even ulcers in the legs.
Okay. So it's something that if someone has something like that, they probably should have it treated or looked at. Okay.
Definitely, if you're having problems with your veins, you should at minimum see your primary care physician and have them evaluated to make sure that you're not progressing to more serious symptoms.
Okay. So is the treatment that you use, you said we said it was non-invasive. So maybe we should define that too. What exactly is meant by non-invasive?
Well, with traditional vein surgery, what we've done is we usually did stripping, which involved making little cuts down the leg and taking patients to surgery, and it was quite an extensive procedure.
Okay.
Nowadays, when we do the procedure, we don't even do the procedure in surgery. It's actually done in the ultrasound suite. We don't even make incisions. We just use a small needle to do the procedure. It's done in less than an hour, and again, significantly less recovery time, and patients are back to work and back to their regular activities much quicker.
Okay.
In less than 3 days.
Okay. Back to their normal activities in less than 3 days. And how did that compare to the stripping that you talked about? What was the time frame?
With vein stripping, the recovery time could be 2 to 3 weeks.
Weeks, okay. Very interesting. So you said that there were small needles that were utilized. So is there anesthesia involved, or the other procedure, I think people were under anesthesia, so.
Yep, that's the great thing about this procedure is we don't need to have what people traditionally think of as anesthesia. We just basically do it under local. So it's not nearly as bad as going to the dentist.
So, not as bad as the dentist, okay. And our apologies to all of our dental friends out there. So that's good. There's not any general anesthesia, so you don't putting people to sleep. Is there, and you said there's very little pain afterwards?
Minimal.
Okay.
And there can be a little bit of bruising or a little bit of swelling afterwards, but very minimal. Don't want to use the word side effects, but like
Okay.
I said, generally people are back to work pretty quickly.
Okay, yeah, that sounds very fast. And is it more common, I mean, the varicose veins occurring in people with a man versus a woman? Does it gender make a difference?
Not necessarily.
Okay.
I think veins are a little bit more common because of pregnancy,
Mm.
but there are plenty of men out there, and again, people that do a lot of standing, prolonged standing for work, teachers, nurses, people that are working in the mines that have to stand, or in a factory that do a lot of standing on concrete all day long. After years of prolonged standing, odds are that you're going to develop some vein problems.
Mm-hmm. So gender doesn't really play a factor, but sounds like occupation could play a factor then, or if you're bearing children.
Yes.
That's a factor.
Yes.
Okay. All right. Very good. And you mentioned a bruising. Maybe you could talk a bit more about that. So as far as there's no or bruising or scarring, is there scarring an issue at all? Or?
Generally not.
Okay.
Generally not, because we're not even making an incision anymore.
Okay.
So there's minimal risk of scarring, and most people are very, very happy with the results that they have. There's been a greater than 95% success rate.
So you were talking about some of the symptoms as far as the bruising and scarring, so really very little that occurs.
Correct.
Okay.
Very minimal bruising and scarring after the procedure. Most patients will hardly notice anything from surgery.
Okay. And when you said a person who has the procedure done, do they need to have kind of the day off? Can they go like come on their lunch break and go back to work, or is it you need to have the afternoon off? Or
I would say to take the whole day off.
okay.
But generally within 24 to 48 hours, most people can go back to work or their regular activities.
Okay.
I wouldn't advise someone to go run, Grandma's Marathon, but just your regular activities you can go back to in
Okay.
24 hours.
All right. Very good. The procedure itself, it sounds like it's pretty straightforward. It doesn't take a lot of time. How much time would you say it would take?
I would say less than an hour.
Less than an hour.
Mhm.
Okay. So it doesn't take a lot of time out during the day. No anesthesia that's used. A person can go home.
Mhm.
Do they have to have someone drive them home, or?
We always recommend that you do have someone drive you home,
Okay.
but you wouldn't need anyone to stay with you for the rest of the day or anything like that.
So what's the process as far as if an individual had varicose veins and they thought, gee, I want to maybe look into that? Do they make an appointment to see you, or do they see their family practice physician first, or does they need to have a referral, or?
Generally, we do want them to see their primary care physician first.
Okay.
and get a referral to come in.
Okay.
Twice a year now, we've done a vein screening clinic. We had one this past fall, and we're
Oh.
going to be having one again this spring, and we'll run an advertisement when we're doing that. But so people can come in and have their veins evaluated for free,
Okay.
and we can give them an idea of where to go with treatment and what they would potentially be looking at.
Okay.
So
And you said you're going to have one this fall?
we had one this fall.
Had it. Okay.
Yep, we did it
All
already.
right. Darn, we missed it. All right.
And we did have a really nice turnout, and we will be having one early this spring
Okay.
at some point.
Okay. So the procedure that you talked about earlier, as far as the vein stripping, that word just gives me the willies. Is that a procedure that still is utilized, or is it, is there some cases where that approach is more appropriate than the Venefit? Or?
Every once in a while, there's particular cases that we still are required to do a vein stripping.
Okay.
But for the most part, I think the procedures that are done nowadays are less invasive.
Okay.
So again, patients don't have the symptoms after surgery, and they can again return back to their regular activities, and recovery is much quicker.
Right.
So that's the nice thing about doing more of these minimally invasive procedures, is again, recovery time is much quicker.
Wow. Yeah.
And a lot less pain.
Sounds like it. What about insurance? And then is that something, do you know about as far as what insurance coverage is at all? Is that something that it's usually covered, or?
It's generally covered.
Okay.
I think a lot of insurance companies are now recognizing that varicose veins are actually only the beginning stage of chronic venous insufficiency, and for certain people it can progress to become quite a significant health problem, and they can get a lot of problem with chronic swelling in the legs and a lot of problems with chronic pain, and they can also get venous ulcers,
Okay.
which are extremely difficult to heal and are extremely painful. So insurance companies have been much more receptive to treating varicose veins early on, and we always do a prior authorization
Okay.
and check with patient's insurance company.
Okay. What about risks or complications? Is that a concern at all, or is it sounds like it would be quite a bit less than it would be if it were the actual invasive approach?
Again, a lot less risks for doing this particular type of procedure. Anytime you have any surgery or any procedure done, there's always risks of bleeding or infection, but with minimally invasive procedures, much less risk of infection. The biggest or the most common complication with doing this minimally invasive procedure is that you could get a blood clot afterwards.
Okay.
But again, that's extremely rare. It happens less than maybe 1% of the patients who have the procedure done. And it is easier to treat, I should say relatively easy to treat. If it does occur, we can take care of it.
Okay.
But unfortunately it does happen, but it is pretty rare.
Okay. Good. Well, everything has risks associated with
Yep.
healthcare and so forth, but there's a risk, obviously, of not having it done as well.
Yes.
So, okay. The procedure itself sounds like it, as you said, it's pretty straightforward. As far as that doesn't take about an hour, you said. There's no anesthesia. I'm just trying to kind of summarize kind of where we're at here. And so they need to see their primary care physician first to get a referral. And you said most insurance covers it.
And a lot of insurances also want to have documented that you've tried non-invasive therapy first, that you've tried using support hose and tried using elevation and taking over-the-counter analgesias before you go to a more aggressive treatment plan.
Okay. Now, if someone has the procedure done, is it once it's done, they never have to have it repeated, or is it potential that the varicose veins could reappear or come back, or?
Depending on why you have the varicose veins, for most people, I would say they're not going to come back.
Okay.
But there are some people that can develop more after the procedure.
Okay.
And those are the kind of people that we do want to follow closely, and may want them to continue to wear support hose even after the procedure.
Okay. So this is a procedure you've been offering in the community for a period of time, and how would you say the response has been? I mean, in regards to patient satisfaction and.
Everyone that we've done has been extremely happy after they've had the procedure done.
Good.
So, yeah, this is one of those procedures where it sounds too good to be true, but it really does live up to everything, to all its claims.
Okay.
Yeah.
So, I mean, I'm wondering about kind of is this based on technology? I mean, is this a new type procedure that's based on new technology that's been developed, or is it just research-based?
Actually, it's been around for about 10 years now.
Okay.
But they've been just continually refining the process, and so it's newer, but I wouldn't say new, real new.
Okay.
And lots of places it's done, and We have been doing it at Fairview now for, I think, about 4 years.
Oh, that long, okay, 4 years, all right. So obviously people in the community have been, I mean, people have had this, and as you said, they have a good success rate as well as their satisfaction with the procedure. Okay.
Yep, it has been very happy and very pleased with the results that we've had with it.
Okay, wonderful. Well, it sounds like, you know, I mean, non-invasive is always a better approach if possible versus the invasive approach, obviously, if possible. And it sounds like this is a development now that is available in the community that's going to be a great addition for our patients to receive that kind of care, that kind of treatment without having to endure actual surgery and so forth. So again, it's called Venefit. So like benefit, but with a V.
With a V.
Okay. All
for
right.
varicose veins.
Okay. And so if someone is experiencing something like that, to see their primary care physician and look for a referral from them, and then they might be able to see Dr. Stoiber. And that procedure is done in the clinic, or you said it's done in the hospital, in the diagnostic imaging?
It's done in the hospital,
Okay.
but we do it in the radiology suite. We don't. It's not actually done in surgery.
Okay.
So it's considered an outpatient procedure.
Okay, good. That's a great point. So an outpatient procedure, and probably should have someone drive them home.